I got started as a chiropractor at a very young age. My grandmother practiced chiropractic until she was 79. My mother practiced chiropractic till she was 72. She had the office right in the basement at home, but no shingle. But people knew where we were. So I grew up having to help people down the stairs to the basement. And in a week or two, they were running up and down the stairs by themselves.
Challenges with Veterans Affairs. I think the system is just so large that it makes communication difficult. Trying to contact anybody by phone is very difficult. We rely on having to do emails to the patient, and the patient emails their primary care doctor. Everything has to come back through us through a computer system. There's no human interface.
I don't think it's the Veteran Affairs that's the biggest problem. It's the chronicity and the problems that the patients have, because, I mean, we deal with things from a mechanical perspective. Realistically, most of these patients have a plethora of issues going on, whether it's TBIs, traumatic brain injuries, diabetes, high blood pressure, post-traumatic stress disorder. So really, health is always a balance of psychological, chemical, and mechanical. So mechanical components are what we deal with, but the other components play a part in their health as well.
Veterans who are interested in healthcare options that don't include drugs and surgery should talk to their primary care provider. The primary care providers are really the gatekeeper for all referrals to whatever services that they need.
We actually have 7 massage therapists here as well. So just recently, over the past, I think it's maybe 2.5 years or so, that the VA started covering massage. The massage is a wonderful thing.
The VA can be slow to send referrals. I don't think it's done on purpose at any way, but the VA can be very slow to get those referrals through. So we recommend that patients use the My Healthy Vet to communicate. The VA has also told us that we can send patients down to walk directly into the community care division at the VA and ask for assistance. So those are the 2 best and easiest ways for a veteran to communicate with their primary care provider.
Realistically, the most common thing that we treat here is probably low back pain. It's not just veterans, but 90% of the population is going to have back pain. 70% of the population is going to have neck pain. And then neck affects arms and heads, causes headaches and paresthesias, numbness, tingling, weakness in arms. Low back affects legs. So it's most commonly pain that drives people to come see us. It's a plethora of issues. And the hardest part with everybody, your body is perfect. My body is perfect. It responds perfectly to whatever you've done to it, and it's cumulative.
We work very hard to make sure that our veteran patients get all the help that they need. The VA is different from other carriers because they authorize treatment in blocks of time. And it's very hard to take something that's a long-standing, chronic, difficult condition and fix it in the time frame that the VA and other carriers think that we should be able to fix it. VA thinks we should be able to fix chronic problems that have been present for years in about 6 weeks. So we work with the VA to provide information to the veteran to take to the doctor. We complete forms that we send to the VA to do everything we can do to make it easier for that patient to get the care that they need.
Ooh, compassion. Whew. We deal with people in pain every day. I couldn't imagine being a hospice nurse, knowing your patient's going to die. My patients ain't dying. They might be hurting, and we're all dying. But if we can give them relief from their suffering, mission accomplished.
The future of chiropractic, I think, is very, very, very bright. More and more people are understanding that they've been victims of a system that tries to see them quicker and faster and offer them fewer solutions. So more and more people are looking for options. They're looking for alternatives. The future of chiropractic has never, ever been brighter.